few days ago, the Trump administration announced that they're going to start helping Americans quit antidepressants and that new policies will make it harder for them to be prescribed. But what does that all mean in more blatant words? See, the Health Secretary, Robert F. Kennedy Jr., has made it a point throughout his entire tenure to reduce the use of antidepressants, and he plans on letting it be his legacy at the end. And the way he speaks about it would have you agreeing with him at first, because he's talking about over-medicating, the withdrawal symptoms that patients go through when they're trying to get off of it, all very real things. He even goes to say that antidepressants or anti-anxieties should be just one option amongst a pool of other options, including psychotherapy. And that is where the gut punch comes in. Every ethical psychiatrist would not prescribe you an SSRI until significant amount of psychotherapy work or a deep analysis says that you absolutely need the medication. So if that's the case, then what is accounting for the overprescribing of these medications? If you go to a family doctor who is not a trained psychiatrist, you're about to lose your mind, you're going through matrescence, you are on the brink of having an anxiety attack, they will prescribe you a medication because that is what a family doctor typically does. You cannot go out as a government official and say something as basic as psychotherapy should be the first line of defense, knowing very well that that line of defense is unattainable for 90% of the population. The behavior of somebody with untreated anxiety or depression is so volatile. And as much as I'm all for encouraging people on an individual basis to try and decrease the use of their SSRI, for many postpartum women, these medications are a lifeline for them. And there's a rising amount of men and youth that are in need of them, especially in the age of AI and cyberbullying. But the reason I'm bringing up women specifically is because of the history of physical and mental abuse, all in the name of hysteria. Kennedy has just completed 1 year out of his 4-year term. So if this is where it's heading, if SSRIs are going to be harder to get, then we have to advocate for the simultaneous ease and affordability of psychotherapy to compensate for it.